Hey everyone, Dr. Barengrutter here. In this video, I'm going to walk you through the surgical guide module, but using the wizard workflow. And that is intended for really basic cases, especially for beginners to the software, placing 1 to 2 implants typically, and typically not going to be immediate implants. You can use it for that, but it takes a couple extra little steps. So really we're focusing on a healed site, missing tooth, and you just want to walk through the software and kind of have it key you into the steps throughout the process. If you're watching this video for the first time, at the bottom on the YouTube the video description, you should see a series of chapters where you can jump ahead to whatever step in the process you want. So when I'm done with creating this video, I'll go ahead and create little stopping points. And if you're watching it, you might notice me pause for a second here or there, and that's really so I can create that distinction between chapters, or at least I'll do my best to do so. Anyway, yeah, if you have any questions, make sure you put them in the comments below. For now, we're gonna get started, and here we go. So, surgical guide module. When we click on this right up here, it's going to give us the option to do a 1 or 2 implant case, an import CT scan case, which is what I would call the advanced workflow, and then there's import models if you're going to do a model-based only surgery. You won't ever see any videos from me on that. Yeah, you won't see any videos from me on that. So 1 or 2 implant case. I'm going to click on this to get us through the wizard workflow. At this point, it's going to ask us, what type of model are you going to bring in? Is your model coming from an STL, which is what most people are using? You know, they either scanned a stone model or they with their desktop scanner or optical scanner, but it's always going to be like an optical model. You brought it in from your Carestream, your CEREC, your Trios, your Medit, your whatever intraoral scanner you're using. A model CT would be if you took a CT scan of that model and created, to generate your physical model of the teeth. And then there's a couple others as well. Taking a CT scan of an impression, and then taking a CT scan of an impression that also had little glass beads or radiographic markers in there. So really, most everyone's going to be working with this very first option, model STL. Now we need to tell it what kit we're going to be using. There are lots of different surgical kits that you might have available to you. I'm going to be walking you through the BlueSkyPlan fully guided kit. That is the kit that I use. A lot of the steps I'm going to go through would be the same with your kit, but there might be some differences. You'll kind of have to just fill in the gaps from there. Maybe ask a question online if you get to something where I don't have a solution for you. So BlueSkyPlan fully guided surgical kit. And now I can click, sorry, this little window is not completely visible because the OK button is off the screen. So I can click OK right here. Now I'm going to bring in, I'm going to have to search for my models. Or my CT scan, sorry. So my CT scan is in this window, or the patient's data, whatever is going to be in this window. We're going to find it, the DICOM data set, and you can click on it, or you can just click on the folder wherever you have this. So click OK. And now the first thing it's going to do is it's going to bring up a window saying, is this a CT scan you want? If you have multiple in there, to list them, but most of the time there's only going to be one in that folder, at least the way I do things. Click OK. And this next step is still part of the whole setting up the case process, but what you're going to need to do is orient the CT scan. Do not skip this step. This is too often skipped step. So let's go ahead and align this so that the occlusal plane is flat. Do not skip this. If you're taking a pan, we've all seen a Panorex that's taken that was not taken well, and it doesn't look right. It looks like the patient's got a reverse smile or something. You can't fix that other than retake it. CT scan's a 3-dimensional volume. This is our opportunity to fix it. Take advantage of that opportunity. Okay, so we have fix this, and do any sort of other rotations that might need to be done. Don't worry about cropping it. Usually that's sort of irrelevant. If you're using a really low-powered computer, maybe you want to reduce the data set so it's not having to process as much. But for the most part, just keep it the same way. Rotate things so that they look good, and then move forward. It is good to This is going to be an upper implant, number 12. So I definitely want the upper arch to be as flat as I can. If I was doing a lower one and this patient's mouth was super wide open in the scan, I might want to tip them back a little bit just to make my life easier. So really try to get the whatever arch you're treating in this situation to be as parallel as you can. Okay? All right, go ahead and click OK. And now it's going to ask us to also search for the STL model. I believe that's the next step. Or no, it's not. Actually, the first step it's going to do is it's going to ask us if we want to map the nerve. Now, you don't have to map the nerve in an upper implant case, right? That's kind of, it's just not necessary. But I'm going to go ahead and show you how to map a nerve because this case just happens to be an upper one, but I want you to be able to use this for other cases as well. So it's telling us, detect right mental foramen. If you click maxilla, it'll skip out of the nerve marking phase and move forward. This will actually create a little problem for us since I'm marking these nerves in a case where I don't need them to be, but don't worry about it. It's not a big deal. I'm going to go ahead and do it so you can see what that looks like. But really, I'm just going to try to find the nerve, and you can either mark it right here, or you can slide around and try to find the, if it's not obvious in the 3D, you can find it in the two-dimensional slices over here and click right there, whatever you want to do. And so we're going to click here and let the software sort of detect it by itself. And now I'm going to review it because I want to make sure that it did it properly. If it doesn't do it properly, just click up here. Do you want to remove it? Yes, I want to remove it, and I'm going to do it again. Okay, so if it does a funky one, like really crazy, try it again. If it still is terrible, well, then you're going to want to come here and manually fix it. Everywhere you see this kind of a white circle, as opposed to, let me go ahead and maximize this. Click on these two little triangles. It'll zoom in. Everywhere you see this white circle, as opposed to the little yellow one, that's an area you can click and you can drag and you can move it around. Okay? So I can use my wheel on my mouse to sort of slide in and out. And everywhere I see one of those white ones, I can move it if I want. But it's staying right within the canal. If you can see it in here, it's kind of hard to tell, but it's right in there. In other words, it did a really good job of automatically detecting the nerve. If it hadn't done a good job, I can just say, okay, let's find a white circle that I can grab a hold of. There's one right here, and I can move it to wherever I want. Okay, so anyway, correct it, make sure it's accurate. Don't just assume the software is right. We always want to check it. And now I'm going to minimize this window because now I'm done. And again, I'm not going to map the other side because I am going to be working on the top up here. I don't need to. And I'll show you in a minute why especially I don't want to do that accidentally. So go ahead and click maxilla. Now it wants me to bring in those models. So I'm going to locate those. Bear with me for a second here. All right, and I want to pick the model of the arch that I'm working on. I don't want to pick her lower arch. I want to pick her upper arch. Okay, we can bring in the opposing, but we don't need it at this point. We want to make sure this is the aligned arch, because remember, the CT scan is taken with an open bite. So we want to make sure that we're linking up, aligning the upper arch to that CT scan. All right, so let's go ahead and click OK. Now I can see some double imaging here in the front, which tells me that the patient did move a little bit when the scan was taken, which means we're not going to get a perfect stitch. We're going to see how good we can get, and then go from there. Let the software automatically align it. There are different ways to manually align the model if you need to. I have a video online that goes through 4 different workflows there. I'm not going to show you that right now. But here's these 4 different cross sections down here. I'm going to click on this guy right here. And then I'm going to either use my wheel or just slide this bar and watch it outline the teeth. And as you can see, it is doing an excellent job of outlining these teeth. So that tells me it is pretty darn precise. And I can tell on either side of this edentulous space, let's go back to that for a second. This is the number 12 site where I'm planning to place an implant. It's well stitched on this tooth. It's well stitched on this tooth. I know I'm looking pretty good. So this could be enough. I mean, it's not perfect stitch, but it's pretty darn good. If the other view I like to look at is this view right here. I'm going to click on it, and then I'm going to come up here, and so here's the upper teeth, and you see the lines outlining the teeth, and ideally the little yellow outline circles should disappear at the same time as the cusps. That tells us that it is pretty darn well lined up. Okay, so at this point I'm happy with what's going on here. Okay, yeah, I'm gonna go ahead and click next to move on forward. Now we have the opportunity to add a tooth to this area, okay? So we can go through the various libraries of teeth. I'm gonna move this window up a little bit. Nope, not make it bigger, but move the whole thing. And there are various libraries, okay? So Christian Brennus has a library of teeth that's a pretty good one. There's a number of other ones on here. I'm just gonna go ahead and stick with his. It's pretty straightforward for this case. Click on this tooth. And I'm going to leave it as medium. We can always change the size. I mean, we can scale it up and down later. If we want, we can tell it to go ahead and add an implant. Actually, we should. Now, I'm going to pick the implant I want. Make sure it's under BlueSkyPlan for the implant systems is what I'm going to be using. You can find whichever implant system in here. I'm going to click on the BioMax implant. I'm going to say this probably looks like a 4.3 by 8 implant to me. You know, I might have to go narrower just depending on the bone. She's got a fairly narrow ridge, but we'll start with this. This is sort of my go-to if I can. Click, move this window. All my windows are slightly off the recording screen. Sorry about that. Click OK. Oh, sorry. What I'd also like to do is I like to turn on the abutment. Go up this panel up top, click Select Abutment, and pick the abutment I plan to use. It just helps me with a visual. It helps me to see where is that abutment. Okay. Now I'm going to click OK. Click OK. And now I just need to tell the software where I want to place it. And I'm just going to click right here in this edentulous spot. And there it is. Everything's in there. Now we're going to move it around, of course. It's too deep and whatnot. Notice that the nerve is up here. Now, as far as I can tell, there are no ways to hide this nerve, because the way the wizards, there's no button in here, because why would you ever mark a lower nerve when you're placing an upper tooth? But now you know how, and if it's there, it's not really going to cause me a problem. It's just whatever. So anyway, that's why it's there. So I'm going to grab this tooth and I'm going to bring it up. And what do you know? It is too small. Okay, I probably should have gone with large, but I can grab these little spheres and scale it to size. No big deal. Kind of change the size changes on the while working on it. And this doesn't have to be perfect by any stretch, okay? This is not going to be a permanent crown. This is just going to give us some information of, okay, this is where the final crown I think I want it to be, so let's plan the position of our implant accordingly. I can tell you from reviewing her CT scan chair side that I'm going to have this implant pretty angled, okay? The hole is probably going to come to the buccal cusp in that area, just because that's where the bone she has available, and grafting, though possible, seems awfully unnecessary in this situation. So again, you don't have to get this perfect. You can, be as tedious as you want, looking underneath and kind of seeing, is it all the way in contact of the teeth, adjacent teeth and whatnot. But there you go. Let's look from back here to make sure it's, about the same level. Cusps look about where they should be. You can always look at the little head down here, which will help you to kind of look from the front. And yeah, I think that looks pretty darn close. Not perfect, but close enough. So we've positioned the crown. Now we can go ahead and say next. Now it's going to ask us, well, here's the implant position it thinks we want. That's not going to happen. So I'm going to move the implant to where I want. And we'll see. But I like having the abutment because it helps me to visualize within the tooth where is it actually going to fit. Now notice that the implant is on an angle here. Depending on which software you're used to, I like to actually have it always upright. I don't like it swinging around as I rotate my view around here. And we're right into that canine. We'll fix that, don't worry. I like this button right up here, which is going to keep it upright, and it's going to make the whole mouth swing around it. Okay, so let's go ahead and rotate this. This just tells me that I should have rotated the crown, the virtual crown, a little bit. Again, that doesn't really matter as long as I'm centered within the cuss. That's kind of what I'm looking for. I like this depth interproximally, but I might have to go deeper based on the buccolingual bone volumes. But you know, this is a starting point. I'd like to be here, nice below the bone. My margin of my abutment here, my tie base is above the bone. I'm pretty well centered in here. Yeah, now I'm pretty much centered. I'm pretty parallel to the contacts. I like that. But now I got to rotate around and see what is that doable buccolingually. It's pretty darn close. Probably going to have to go a little bit deeper, end up using a slightly taller tie base abutment, but we're getting there. This bone right here is not real dense, and it's going to be kind of hard to tell until I'm in surgery. Is there actually bone here? It's just not showing up on this view, or do I actually have to go deeper? That's one of the things I like about the fully guided kit, the BlueSkyPlan fully guided kit, is I can always go deeper if I want. I can adjust a lot of things. The only thing I can't really change is trajectory. But I can change depth, I can change platform depth, I can change implant length, implant diameter, all the above on the fly. It just makes sure that I keep centered in the direction I want it to go. And so right now I'm feeling pretty good about all this. And yeah, that's about it. So we've got the implant positioned the best that I can get it. And now I can click next. So what it's going to do is it's going to create what's called an undercut model. And that's because when we make our guide, we don't want our guide getting stuck in any undercuts. So it's going to make a model with all the undercuts sort of blocked out. The software has a default for those parameters. So if you don't know how to change that, wait till the end of the video because I'm going to show you how to change that parameter. I have changed mine to 20 degrees when the default is 30 degrees. I believe I've changed it on this computer. At the end of this video, I can't do it right now. I can't access that part. But at the end of the video, I'm going to show you how to do that. So if you are watching this and you only care about this part, zip to the end of the video and you should be able to find it. Okay, so back to this. What we need to do is we need to, now it says that a collision has been detected between the software guide tube and the model. And what that means is this guide tube is sitting inside the model. When it makes the surgical guide, it's going to cut out from the guide tube the model because you can't just invade the model. The model will get in the way. So it means that the guide tube is going to be pretty short. So what we need to do is the software is saying, well, resolve collisions, that means it's going to make it high. Sometimes I think it makes it too high, but let's go ahead and let it try its fix, and I'll try to explain what it's done to fix it. If you say do nothing, I got this covered, that means you're going to go ahead and accept that it's super short or make corrections on your own. So let's go ahead and let the software try it itself. And that was a pretty conservative adjustment. So what it's saying here, let me read this to you. Implant 0, that's the number of the implant that was placed here. If you add more implants, it starts at 0, then goes 1, 2, 3, whatever. The guide tube is raised 2 millimeters. So the final drill is going to be 3.9 yellow, but it's 3.9 by 10. That's what this 10 means. And what that means is that your drill that you would normally use a 3.9 by 8 millimeter for an 8 millimeter implant, you're going to use a 10 millimeter. It's going to be a 2 millimeter longer drill because this guide tube has come 2 millimeters away from the implant. So you're using technically a 10 millimeter implant drill for an 8 millimeter implant. That just allows you to get this little tube farther away from it. And that's very reasonable. Actually, that's what I would have done myself if I'd done it manually. Sometimes it makes it so high that it's like, that's too much of a change. And the drill report will go ahead and tell us this at the end anyway. So when we're in surgery, we don't have to remember this. The drill report will tell us this. So click OK. And you can see that's what's going on. So I'm going to see. Okay, so let's take a look. Now this isn't something you're going to do, but I'm going to show you what would have happened if I had left it. So right now we can see the internal portion of the guide tube everywhere. The outside does not matter. It's the internal aspect of it that is critical. So if I right click on this implant and say software guide tube default settings, okay? This is where it was when it detected that collision, but you see how the model's sticking up in here? The software is designed to respect the model, which means the printed guide would only have this much guidance, this much height, to help control your implant drills and your implant carrier. So it says, well, that's not a lot of control. We need to raise this tube up higher so you can have the control you need, you want. So that's what it did. And I'm going to go ahead and repeat what it did by simply right-clicking, hit Software Guide Tube, and raise. And it's perfect. You can technically do it again. Software Guide Tube, raise, and now it's up another drill length. So it went from the 8mm drill that's normal, 10mm, which is the next step, up to an 11.5mm drill if it really was deep or a lot of things interfering. But I'm going to go ahead and say back to default and raise it one time. So this is where the software fixed it for us. Perfect. That's exactly what I needed to do, and I'm good there. So now I'm going to draw my guideline. Technically, draw guide curve. We were in this step for a while now. So I'm going to hold the shift button on my keyboard. This is sort of the action button in the software. Okay? So if I hold the shift button, I can draw a line. I can pick up and stop and move the model whenever I want to keep drawing. And you don't have to like pick up where you left off. You can just keep drawing. That second little line I had in there, it had a little bit of a difficulty trying to connect that. It made it work, but didn't give me any more nodes. I say nodes, I mean these little dots here. And I can always move them wherever I want. And if it doesn't connect, you can just drag one over top, or you can draw it all the way to the end line. And now it's solid. You have to have it connect. You have to connect the dots at the end so it knows where everything truly starts and finishes. Okay, so there's my guideline. There's lots of thoughts about where you should put it. I usually put it right at the general margin. In the past, I would put it at the height of contour, but I realized after a while that that was just sort of silly, wasn't necessary. Okay, so we're going to add a window, which is like a little hole in the guide so that we know that our guide is fully seated. And to do so, I'm just going to right-click where I want to put it and say Add Window. Now I can scale this to whatever size I want and move it. I'm going to tell you that what I've been doing more and more is bringing it so that it just goes right to the inside, the facial surface of these teeth, and then right halfway through it. Just grab the whole thing and push it right there. It doesn't need to be scaled this big. The guide is going to be 3mm, and wherever this is, the guide does not exist. You'll see what that means in a minute if that doesn't make sense to you. So this is enough of a window so that when the guide seats, I can see her teeth sort of sticking in the guide. And again, you'll see what that looks like in just a moment. So I've positioned this, I've scaled it, and now I can go ahead and click Next. So it is now fabricating the surgical guide. Okay? It's going to give us the opportunity to add a window should you, had you forgotten to do it. If you do that, then it's going to have to recreate the guide after you add the window a second time. So that's why I did it here as opposed to waiting. All right, so here is my surgical guide. So you can see the little window. So when I seat the guide, I'll see the teeth in there, and I can tell if they're sitting, pretty darn close to flush. That means it's seated all the way. And here's my hole, my guide hole. And one thing you're looking for is that if you notice that these teeth stick out here on either side here, that's just because the guide tube was down farther. And we have this, if you look, there's another circle in here. Okay? And that's called the brush distance. And all that is it creating room for your handpiece to get in there and not get stuck while you're drilling. You can actually go in the parameters and decrease that default brush diameter, which is 15mm. You might go down to 12 or 13. Any lower than that, and you might have trouble with your handpiece. So anyway, that's it. The guide is created, and at this point, we're just going to save and export. Okay, so let me go ahead and click Next. Oh, notice up top here, Create Guide with Windows. So if you've forgotten to add a window, you can right-click and add a window here. So it's giving you the opportunity, oh shoot, I forgot to add them. But again, if you do that, then you have to click recreate the guide, and then it's going to be going through that process again. So save yourself the time. Just add it as soon as you're done drawing your margin. Okay, in this step, this is when you're all done, you're verifying the surgical guide. And what you want to do is you want to come down here and look to make sure everything fits the way you want it to. There's no interferences, because this is not the undercut model. This is the original model. So it's a chance for you to make sure everything looks good. Okay, so I'm going to hide the software guide tube. All I did was I right-clicked on the implant, go down to visibility, and click there, so that I can look from underneath, and there's no interferences. If you see something red sticking through this guide, that's telling you that the guide's sticking through. I'm not gonna lie, I've seen that happen before, so it is a good opportunity to check to make sure your guide is going to fit passively. Okay. Once we've done this, we can go ahead and click next, and it's going to give us the opportunity to save our guide wherever we want. Okay, it's saved everything. It even saved the project in case we need to reopen it. It's asking us, would you like to complete this case approval form before sending? I don't typically do this. This is more if you're working with a third party and whatnot. So I'm going to go ahead and just click no. And this is your opportunity to go ahead and send this out if you want to have it printed for you and whatnot. Okay, I'm going to click close here. And here is what the report looks like. And so you're going to want to save this to your computer somewhere. I will upload it to my patient's chart as well so that I can open it up in surgery and reference it. It's telling me, what drills to use, drill 1, 2, 3, 4, 5, and then 6, the final drill that I need to use to get to full depth, and then place it. So it's giving us all the, what implant I used, which tube, the metal sleeve that goes in that hole, which one you're going to use for that. It's going to tell you which abutment, all the above. So click OK, or I'm going to close out of here. I'm going to go ahead and save this. Bear with me for a second. Never mind. It already has been saved. Duh. It saved my surgical guide, saved the project, and saved the report. And this is just me. It's showing me what the report looks like. And so treatment plan, surgical guide, drilling report have been saved to my folder. Click OK, and you can open the folder if you're ready to print or whatnot. Just click OK. And at this point, we're going to click next. Okay, so at this point, it's going to basically auto-populate our cart in BlueSkyBio with the abutment we need, with the fully guided kit. If you need it, you can always click the X to get rid of that. It's got your implant, and it's got your sleeve that you need. So you can always change this stuff, but if all you want to do is just get the parts that we're using in this case, you're ready to go, and then you can check out. So that's pretty much it. At this point, it's like, okay, do you want to start a new case, or do you just want to close the wizard? That's what you would do. And so I'm going to show you how to change those preferences in just a second. But yeah, I'm trying to think if there's anything else I need to cover before I close this. Okay, so when you get this screen, if you want to change your parameters for the insertion access, we're going to come up to Tools, Preferences, Surgical Guide. Down here we have Default Insertion Path Direction. The default in the software, when you download it and install it, it's going to be 30 degrees. We decided on a number a while ago, and 30 was what we came up with. I've just found that after doing that, I realized that, I think we were too much. And that's nobody's fault. It's just one of those things you kind of just figure out over time. So I've changed mine to 20 degrees. I feel like that gives me a good average block out. In the advanced workflow, you can actually customize it to each individual patient. In the wizard workflow, you do not have that opportunity. So leave it. I would change it. I would recommend you change it to 20, but you don't have to. That's just my personal preference. Okay. So anyway, that's it for this series or this video. Hopefully this is helpful on the wizard workflow, and that'll get you started on your more simple cases. All right, let me know in the questions in the comments if you have any questions. Be sure to check out the description at the bottom of the video for all of the individual chapters throughout this video if you need to come back to reference a specific step. And aside from that, make sure you do me a favor to like the video, subscribe to the channel if you want to know about new videos coming up and whatnot as I post them. And then check me out on Facebook and Instagram, Baron Grutter DDS, where I post cases and new tips and tricks that I learn along the way. And lastly, if you're looking for live courses, hands-on courses to take, or if you just want to know an easier way to find all of the different videos I record, it's actually easier to check me out on my website at barongrutterDDS.com. I've got a lot of free tutorials up there, got links to some of the tools and whatnot that I use in my office, and yeah, and of course, course dates and online courses that you can purchase as well. All right, thanks so much. You guys have a good one. Bye for now.